Hey guys, today we're going to run through how to do a patient care plan for a DVA client. So a patient care plan or a PCP is our initial report. We have to complete this the first time we see the client and then of session 1 of the new treatment cycle. For a TPI client, you also have to complete this at the 6-month mark of that cycle. So the first thing you want to do is go into the funding tab. Make sure you've created the new referral. What that does is it generates this dark blue referral here in the clinical notes section. This is where we want to upload our reports. You also want to upload your referrals or any documents to here. So add a new note which will be attached to this referral. Select the location that you're working out of. And then go into templates and type in PCP and generate that template there. Anything bracketed will automatically get filled in, so the patient's name, date of birth, etc. will automatically get added when we publish this document or email it, but we want to add in anything that's missing. So go into the client's funding section to find the DVA number. You want to copy that, paste it into the report. Previous treatment, it's yes or no. So if they're a brand new client, they've never seen us before, it's no. If they've already had a treatment cycle with us before, it's yes. Has the client consented to the PCP? Yes. Then you want to add in your information, so whatever your profession is, and then your provider number. You can do this, find this on any of your invoices. If it's not on the invoice, you can email admin and they'll let you know, or log into your Aproda account. Your signature, you can either write it in or feel free to paste your actual signature, whatever you prefer. Conditions being managed, again that's in the funding tab as long as you've added those conditions in there, and you want to add that in. Now with the client goals, you want to make sure you have a couple of goals that will pertain to the client's condition. For today's video, I'm only going to add in one, but you want to make sure that there is objective and subjective information, okay? So my client's condition is a torn plantar fascia, so obviously we want to strengthen the lower body, we want to improve the arch support and reduce pain levels, and then you want to have your objective information in here. Whatever other testing you've done, whether it's sit to stand, single leg balance, whatever, I would then add different goals for that as well. Goals been set with the client? Yes, they have been. For the proposed management plan, I use the same one for every PCP. I have the client's name, what they're attending, EP or physio, how many times per week I think they should attend, and it's for ongoing management of their medically approved conditions. I'll encourage you to use this one or come up with your own one. It's just a general statement of what your plans are for their management. Now into the table here we have our initial assessment score. So the date of that, if it's the first time you've ever saw the client, it's going to be today's date. If they've had a previous treatment cycle with you, it's the first time you ever saw them. This date will never change. This date here will change, so if it's the next treatment cycle, it will change to 12 sessions time. Because this is the first time we're seeing this client, it will of course be the same date as the initial assessment. In the table, you just want to add in the assessment stuff that you completed and the scores they achieved. So again, because it's the first time we ever saw this client, you copy and paste the outcomes into both columns here. And then the next part is to make sure you add in an interpretation of the outcome. So it doesn't have to be a lot of information, just a couple of paragraphs basically telling DVA what these results mean. Okay, so DVA are not allied health professionals, so they need to kind of have it in layman's terms. So just 1 or 2 sentences, again using objective and subjective information to explain what these mean and what it means for the client. Once you've done that, then go over here and publish the document. What you'll find is that all the information that was in the brackets has now been filled in.